Certainly, the Dutch also started the first hospital in Sri Lanka, the Dutch hospital. That was the first one. By the way, it was not a government hospital, a private hospital. We were run by the Dutch East India Company. There was also a health service here in Jaffna and a hospital because people had to be looked after and they couldn't be sent by sailing ship to Colombo. So in that way, they have set up the health service. And I must say it was continued when the British came and the missionaries. For instance, the Green Hospital, which you started, was one of the first hospitals in the country. And this whole service went on. And there were doctors and doctors and doctors there. But of course, all the medical personnel who came all served as a Jaffna hospital. There were no other hospitals out here. So all were serving in the Jaffna hospital. But Jaffna nevertheless had a good medical service till it broke down under the constant fighting which went on from 1983. I must thank the Dutch government for this facility which has been gifted because you are shifting it out of Jaffna into Point Pedro. And not only Point Pedro, at Kilinochchi, Mankulam and Vaunia, you are spreading it out. So that I must thank you all for the initiative that has been taken to develop hospitals outside the city of Jaffna. And I have no doubt that this practice will continue and that we will see further advancements as far as these hospitals are concerned. Because Jaffna has a large number of medical personnel. I think more are serving abroad than they are serving in Sri Lanka. And I must say the National Health Service of UK will break down if the Sri Lankans, Indians, Bangladesh and Pakistan walk out. It is to that extent that we have gone in here. But now we have to think even of our own health system. When we started the health system in the 1930s and continued after independence, it was basically to deal with malaria, with children, with pregnancies. And actually it was strengthened during World War II by British, who further strengthened the system to serve the forces and the needs they had. So this system we have carried on. But now the whole profile of disease have changed and of illnesses have changed. For instance, you could see in our demographics, the birth rate has reduced. Then what have we got? We have larger number of older patients, the old age, to look after them. Then the different types of illnesses that are coming in. For instance, diabetes, for instance, cancer, many of the others. Then you have these pandemics like COVID, which came from nowhere. So the whole system is different. We can't run on one which was based on tropical medicine for tropical diseases. That's non-existent now. So the state minister has described to you many of the measures that we have been taking. But we have to think far more. What are we going to do? What is the future going to be? For instance, for every person we train as a doctor or a nurse, for every 100, I think about 30 or 40 leave the country. It's alarming. In fact, only on Monday I asked the Kotalavala Defence Academy and its hospital to increase the intake even up to about 200 or 300 just to meet up with this need. So there will have to be more and more facilities for training. We have given the NSBM, the National School of Business Management, the Green University, the right to run teaching hospital, and Lyceum also has been asked, will also get the right to run a teaching hospital. So this is one part of it. Secondly is, how do we deal with this? We have to change the whole concept of medicine as we've been doing. We can't do it ad hoc. But that means today, technology. Technology means it's more expensive equipment. How are we dealing with it? With AI coming in, how does it change the whole medical system? So we've got to think of it. And then where are we going to find the money? With the IMF, we have come to an agreement on the percentages, what we can do. So unless we develop rapidly, we will run short of money. So these are some of the issues that we have to face, and the government will go into it. Now that we are finishing the discussions with the IMF itself, but the whole issue of what is the health service, how do we do it, do we have national insurance, do you have some other system, do you look at how Scandinavia is financing its system, or do you look at how New Zealand or others are doing? So these are important issues that we will have to take up in time to come. I don't want to take any more of your time, but I want to thank the Dutch government for this generous gift that has been given here. Thank you.